Okay, so this is going to be a super niche video designed to help people who are interested in specializing as a musculoskeletal or MSK physiotherapist. So if you don't fall into this category, then feel free to click off this video and tune back into the next upload, which will be more relevant to you because it will be the fitness, injury rehab stuff that you'll probably subscribe to my channel for. With that out of the way, let's begin. Becoming a Band 6 MSK physiotherapist was always my goal. Even at university and during placements, during rotations, it never wavered. And if you've clicked on this video, it means one of three things. 1, you want to specialize in MSK. 2, you've applied to an MSK role and are awaiting an interview. Or 3, you have an interview next week. I remember when I was applying for my first Band 6 MSK role after only 7 to 8 months of being a Band 5 because the role became available. One of the more experienced Band 6s said to me that due to my lack of experience, I would have to blow this interview well out the park to even have a chance of getting the Band 6 role. I wanted to prove him wrong, but unfortunately, he was right. I didn't get the Band 6 role first time. But the prep that I did for it was freaking immaculate. Some of the Band 6s in the department asked to see my notes, and I showed them, and they were like, whoa, this is like beyond. This is beyond what you had to do. This is everything that you needed. Not only that, but in the interview, there were things that I didn't get. And so I wrote these down in my little prep notes, and I came up with model answers for them. And the next time I applied for a Band 6 MSK role, which was around 4 to 5 months later, I was ready. Plus I had learned and developed so much since the first interview. And I got the role pretty much in record time. I think it was the fastest climb from Band 5 to Band 6 in the entire trust's history. Now, in this video, I'm going to take you through the interview and application process. I'm going to go through some mock questions, and if you stick around to the end, you significantly increase your chances of getting that Band 6 MSK role. Pretty sure this is the only video like this on YouTube. It's super niche, and it's going to cover everything that you need. Great, so now that I've given you a bit of background, we can move on to the application and the interview, the meat and potatoes of the video. First things first, if your application is shortlisted, you will be invited to an interview. You can be an internal or external candidate. Now, the thing to say about internals is they definitely have an advantage over the externals, right? If you're an internal candidate, if you're already working within the trust, you have a huge advantage over the external candidates. Now, I just want to add that if you're familiar with the point scoring system already from the Band 5 interviews, that's great because we're going to cover that in just a little bit. You should know what to wear, but just in case you don't, a little refresher. Smart attire, so men suit and trousers, or at least a smart shirt and trousers. Black polished boots, or at least very dark brown boots. Women, please wear longer skirts over the knees because first impressions count. Arrive on time or slightly early, but not too early. Shake the interviewer's hand. Have good eye contact and maintain good posture. The interview structure is relatively straightforward. If you've been through Band 5 interviews, it's pretty similar. You've got your welcome, your intros, and your icebreaker. This is more important for external candidates as they want to make you feel more comfortable and get to know you a bit better. But if you're an internal, they'll do it anyway, just as a formality. And then you've got a about you section, which is usually brief, and they might ask you, why now? Why are you applying now for the Band 6 role? Why do you want to be an MSK physio? And of course, why this hospital? One of my colleagues who applied for the Band 6 role, she got some really good feedback talking about how she stood out against the external candidate who was pretty much just as good. But because she talked about how passionate she was about working in the trust, she got it over him. Then you're going to probably move on to your clinical scenarios and managerial questions. And then you might finish off with a practical assessment, okay? But the practical assessment could come in between the clinical scenario and the managerial questions. So, clinical scenarios. The questions that I'm going to cover are the ones that I struggled with the first time round. The questions will be purely MSK and some orthopedics as well. It's a point-based scoring system. So the interviewers are looking for keywords, phrases, points, Why do they subject you to this cruelty, right? It's to be objective. We're going to cover some model questions, give you some model answers and break them down. Typically, you will get a red flag or neuro question. You need to know your red flags and you need to know your 5Ds and 3Ns. So the question was, you get someone coming in to clinic with neck pain. You've been treating them for a little while and they're starting to get a bit better, but they suddenly start presenting with new symptoms. For example, one or more of the 5Ds and 3Ns. Please go and research them. I'm not going to go into depth here, but The important thing is you know what they are. So that's the question. And then your solution would be saying, well, you have to demonstrate through the interview that you know that these are a problem. You would then say, I would probe deeper out the questions. I'd want to find out a bit more when they started, what symptoms they're getting. You want to know your cranial nerve testing, so please revise those. You probably won't have to know everything absolutely off by heart. You just say that you do a cranial nerve test and you'd have a prompt sheet. Like even when I was a band 6, I had a prompt sheet for my cranial nerve testing. You then might discuss with a more senior physio, either a more experienced band 6 or even a band 7. You would then liaise with the ESP or extended scope practitioner if you were still a bit unsure. And if they get any more sudden or more serious symptoms, you send them straight to A&E because you want to rule out things like CAD, which is cervical arterial dysfunction. There are 8 points, right? It's out of 5, so you got to get 5 of these. You might also get a rheumatological inflammatory pain question. So this is the one that I got. What are some signs and symptoms of inflammatory joint problems? So you got to know your screen down. You've got pain, redness, warmth, swelling, night pain, prominent morning stiffness that lasts at least an hour, maybe 2 hours. They might follow up that question with what are some nice guidelines for treatment for this inflammatory or rheumatological pain. Refer to your nice guidelines. You've got onward referral to GP for rheumatology, purely like physiotherapy exercise. And a really interesting story is, I don't know if you guys know Imagine Dragons' Dan Reynolds, the lead singer. Obviously he's in very good shape, but he had ankylosing spondylitis, right? And he exercised, he did everything right, and now he's fine. Absolutely, exercise can fix these things, and he maintains a really active lifestyle now. He's in great shape, he's doing so well. There's also hydrotherapy, which is fantastic for people with rheumatological pain, especially like fibromyalgia. You also might get given a differential diagnosis question. This is the one that I got wrong, okay, so like pay attention. A pediatric patient is seen by you in the clinic complaining of shin pain. What are the differential diagnoses and what should you look out for? So the first thing that comes to mind is obviously you're going to ask your questions, do your subjective assessment, objective assessment. The things that you could think are medial tibial stress syndrome, MTSS, shin splints, often due to repetitive stress on the tibia and associated musculature. So your tibialis posterior and soleus, especially in runners, dancers, or those that participate in high impact sports. Know about tibial stress fractures. This is going to be more localized, more point tenderness. Pain may persist at rest and at night. You've also got CES, or chronic exertional compartment syndrome, which is bilateral tightness, cramping during exercise. Pain is relieved by rest. Key, relief by rest, returns with exercise. You've got popliteal arterial entrapment. This is much more rare. You probably won't even have to talk about it. I just did my research and I found this out. I didn't get asked. I don't think this was on the sheet, but if you can demonstrate that you know about this, wow, bloody impressive, I'm telling you. Intermittent claudication. Right, during exercise, you have reduced pulse with ankle dorsiflexion or plantar flexion, and you need vascular assessment. So check your popliteal pulse, your dorsalis pedis pulse. You could also get referred pain from the knee, hip, or the lumbar spine. If symptoms don't match the mechanical loading patterns, you might want to do a neuro assessment, screen joints above and below, as you always should. But the main one, you need to say this. You need to be aware that it could be a tumor or an infection. Very, very rare. Know your red flags. So if it's a bone tumor, it could be some sort of osteosarcoma or some osteoma or osteomyelitis, which is like infection of the bone, which could mimic MTSS. Look for night pain that's unremitting. Look for systemic symptoms, fever, weight loss. Pain does not relieve with rest. This is the key one. Right, so those are the clinical questions. There are so many more clinical scenarios that I could cover here, but we'd honestly be here for hours. For those of you who are interested, I cover basically all the clinical scenario questions that came up during my interview, which is quite a few of them, and I prepared for many more. Remember that my prep was immaculate. I go into more detail about this in my Band 6 MSK interview application course. Link is in the bio if you want to really increase your chances of getting into becoming a Band 6 MSK Physio. It's helped quite a few people already, so go and check it out. Swiftly moving on to the managerial questions. Part of being a Band 6 MSK Physio requires good clinical reasoning as well as a depth of knowledge, but one thing that people don't realize is how much it relies on managerial skills, good leadership skills. You've got to be able to manage your Band 5, you probably will have to manage a Band 5 physio assistant, and almost definitely you'll have to manage students. You might also have to deal with a lot of complaining patients, because patients complain a lot. One of the questions that I got was, one of your Band 5s calls in sick in the morning, just as you arrive. They have a full list of patients and so do you. What do you do? You're going to need to triage, right? So you're going to need to look through who needs to be seen, right? Who's got the most pressing issues. A patient who's just had an operation is going to need to be seen more than someone who's got chronic back pain, for example. You're going to need to rebook the patients. Call them up, apologize, see if you can accommodate them. You know, if they do turn up, you're going to have to accommodate them. Someone in the department's going to have to help. If that's you or other colleagues, can sort of chip in during your admin breaks, and then the new patients can be rebooked with anybody, right? This is a question that came up in my interview. What would you do if two members of staff fall out and have an argument? So the first thing you want to do is arrange a formal meeting between the two, thank both of them for making an effort and being there, hear both sides of the story, stay impartial and objective, don't pick a side, understand both points of view, and it's not always what's been done, but it's how that person has been made to feel. Compromise and collaborate, write this all up. Hopefully this can be sorted then and there, but if not, you're going to have to escalate to the band 7 or the band 8 manager, the big dog. The practical assessment. You have a patient who has been in the cast for 6 weeks after fracturing his olecranon in his elbow. He's presenting with a lag of 10 degrees off full extension. What manual techniques could you use? So you've got your MWM with a lateral glide, okay? This is the one that I didn't get, but then after the interview, you know, the feedback was really good. So I literally revised that, even though it didn't even come up in my second interview, but that's why I'm sharing it with you guys now. You've also got myofascial release or soft tissue release of the biceps. And then you've got to also think of the shape of the elbow joint. I want you to imagine that the elbow joint, I mean, the actual elbow joint is like that, and it's kind of a hinge joint. It's a hinge joint, isn't it? So think your Lego man arm, and then the hinge is like that. So think about when you're trying to get more extension, you're going to have to cause a bit of a distraction, and then you can extend, right? It's no good just trying to jam it like that. You've got to pull it out gently, and then distract and then extend. 3 sets of 10, keep reassessing, practice your handling, practice on people. Of course, there are more managerial questions and more practical scenarios, but again, this is all in my band 6 course, so definitely go and check it out. After the interview, you might hear back after a few days, and the waiting is painful, but you're either going to get a rejection or an offer. If you get rejected, like I did first time round, okay, it's fine, not a big deal, not the end of the world. What did you learn and how can you improve? Ask for feedback, because at the end of the day, it's all learning. Feel free to DM me any questions on Instagram at @therealmattchong, or comment them on the video, and of course I'll do my best to answer them. As I said, complete guide, band 6 MSK course has helped so many people already. Link in the bio. It's literally the first link down. Covers more clinical questions, managerial questions, essential knowledge about safeguarding, you've got to know this, dealing with suicidal patients. If you're serious about getting a band 6 MSK job, then go and check it out. See you guys in the next one.
I'm on my own, broken alone. I feel the rain crashing down all around this empty town. I'm searching for the lost and found.